Welcome to the Healthcare Integration Update webinar covering changes coming in April 2016. This is training session 1 of a 3-part webinar series between now and the end of December. The purpose of this webinar is to provide you with a foundation of awareness about healthcare transformation efforts currently in process and upcoming implementation plans. Information regarding the 2 additional webinars in this series will be shared roughly 2 weeks prior to the scheduled webinar. These additional webinars will cover specific aspects of healthcare transformation to provide you with the tools to assist Apple Health individuals. In 2014, Substitute Senate Bill 6312, or SSB 6312, was passed directing the Department of Social and Health Services and the Healthcare Authority to alter how the state purchases mental health and substance use disorder services. The combination of mental health and substance use disorder services is referred to as behavioral health. The terms chemical dependency and substance use disorder, or SUD, will be used interchangeably during today's presentation. SSB 6312 directed us to create behavioral health organizations and early adopter regions. We'll discuss these further during today's webinar. This legislation guides the state to fully integrate the financing and delivery of physical health, mental health, and SUD services via Medicaid managed care by 2020. Effective April 1st, 2016, SUD services will no longer be provided on a fee-for-service basis. All SUD services statewide will be within managed care. These services will be provided within behavioral health organizations, also referred to as BHOs, and in the early adopter region by managed care organizations, also referred to as MCOs. The focus will be to ensure integrated service delivery, including care coordination between physical and behavioral health care settings. SSB 6312 mandated common regional service areas, also referred to as RSAs, for purchasing managed medical and behavioral health services. There will be 10 RSAs established statewide. This collaboration aligns interests around a common population with multi-system service needs. These efforts bring partners together for shared accountability in completing directives of additional legislative direction. Effective April 1st, 2016, the regional service networks, also known as RSNs, will no longer exist. This slide shares the 10 regional service areas designated statewide as of April 2016. The early adopter region is comprised of Clark and Skamania counties, as shown in dark purple on this map. You'll commonly hear these counties referred to as Southwest Washington. The other 9 RSAs will become behavioral health organizations. Within Southwest Washington, There will be no behavioral health organization or regional service network. In order to complete these changes, enrollment will be streamlined to offer earlier enrollment into managed care. Currently, when a client is determined Medicaid eligible, they are enrolled in fee-for-service or FFS for the first month, and then prospectively assigned to a managed care organization or MCO for the following month. In April 2016, Medicaid clients will no longer wait until the following month to be enrolled in an MCO. Instead, they will be enrolled retroactively to the first of the month in which they are determined eligible for health coverage. More details will be shared in future integration webinars. This diagram represents the transition from multi-system service purchasing that will be transformed by January 2020 into a fully integrated managed care system statewide. In April 2016, Apple Health Managed Care will be present in each behavioral health organization region. In the early adopter region, Southwest Washington, there will be no behavioral health organization. The Healthcare Authority will contract for all healthcare services in the early adopter region within managed care. The early adopter region will offer fully integrated managed care, including medical care, mental health, and substance use disorder services for Medicaid clients. This map highlights the 9 behavioral health organization regions, as well as the early adopter region in Southwest Washington coming in April 2016. Managed care services will continue to be available in all counties. Current Apple Health managed care services will remain available in behavioral health organization regions. DSHS and HCA have collaborated on the creation of BHOs and the early adopter region to ensure that individuals experience better health during their lives, receive better care when they need it, and care is more affordable and accessible. Managed care organizations contract for physical health services for clients and mental health services for clients who do not meet access to care standards. The majority of Washingtonians who are eligible for Medicaid-covered services will reside in behavioral health organization regions in April 2016. Healthcare Authority will continue to manage Apple Health contracts in behavioral health organization regions moving forward. BHOs and MCOs will work collaboratively to provide the full array of mental health, physical health, and substance use disorder services. The largest change in behavioral health organization regions will be the transition from regional service networks, or RSNs, to behavioral health organizations. DSHS will manage the contract with the behavioral health organizations. BHOs will provide substance use disorder services and specialty mental health services for individuals who do meet access to care standards. Another significant change is the move from fee-for-service to managed care for substance use disorder service providers on April 1st, 2016. Behavioral health organizations will be established within the regional service areas except in the early adopter region, Southwest Washington. There will be one BHO for each RSA. Scope of services includes specialty mental health services for individuals with higher level mental health needs and most substance use disorder services. Medicaid will pay a monthly per member per month rate to each behavioral health organization to cover the cost of providing behavioral health services to eligible clients in that region. Behavioral health organizations will each receive grant and legislative funds to provide behavioral health services. Beginning April 2016, Healthcare Authority will contract with MCOs at financial risk for the full scope of Medicaid physical, mental, and substance use disorder services only in the early adopter region. Regional service network contracts will expire on March 31st, 2016. RSNs and county-managed fee-for-service substance use disorder systems will cease operations. Counties will no longer be at financial risk for behavioral health services. HCA staff have been collaborating with an implementation team from Southwest Washington to prepare for the implementation of fully integrated managed care. HCA is currently conducting a competitive contracting process for no less than 2 MCOs to serve the Southwest Washington region. More information about the MCOs selected will be shared in a future webinar. The decision to become an early adopter region was completed at the local level by Clark and Skamania County Councils. This chart shares the differences between the BHOs and fully integrated managed care in the early adopter region, Southwest Washington. In behavioral health organization regions, these organizations will take the place of RSNs to provide behavioral health services. DSHS will manage all behavioral health organization contracts. In BHO regions, HCA will administer Apple Health managed care contracts for physical health services. In fully integrated managed care in the early adopter region, at least 2 MCOs will provide physical and behavioral health services. There will be no RSN or BHO in the early adopter region as of April 1st, 2016. HCA will administer fully integrated managed care contracts in the early adopter region. There is one similarity statewide in BHO regions and the early adopter region, that all substance use disorder providers will be moving from fee-for-service to managed care. The Apple Health foster care contract will cover services for foster children, foster care alumni, and individuals who receive adoption support services. The legislature, in Substitute House Bill SHB 1879, directed the Healthcare Authority to provide services to individuals noted above in one managed care contract with one managed care organization statewide. In 2015, the legislature further clarified that they would like this one MCO to provide fully integrated physical and behavioral health services for these individuals by 2018. The Apple Health foster care contract will begin April 1st, 2016. This contract with Coordinated Care Corporation will include physical health coverage only. After implementation in April 2016, HCA will begin activities to prepare for full integration, physical health, mental health, and substance use disorder services by 2018. 2 additional webinars in this series will be offered in the near future with more specific detail about the early adopter project, including fully integrated managed care services, behavioral health services organization services, Apple Health managed care enrollment, managed care organizations, administrative service organization. For more information about the topics covered in today's presentation, HCA and DSHS website information is listed on this slide. For early adopter questions, please email HCA at earlyadopterquestion@hca.wa.gov. For behavioral health organization questions, please email DSHS at bhotransition@dshs.wa.gov. This video and presentation slides will be posted in 7 to 10 days on the HCA training and education website listed on this slide. Thank you for joining us today to learn about healthcare integration. Two clarifications I wanted to add related to Apple Health foster care are that the managed care organization selected to administer Apple Health foster care is Coordinated Care of Washington, or CCW. Additionally, Coordinated Care of Washington will have a contract that includes physical health services, mild to moderate mental health services, and inpatient detox services. Great. Okay. Well, thanks everybody for joining us. That's the end of our video presentation and updates. And now we're going to start our question and answer session. We don't have very many questions coming in, so please send them in ASAP so you can get your questions answered by our experts here in the room. Okay. Question number 1. Are tribal members still exempt from managed care if they choose? Yes. However, in the early adopter region, and I think as Stephanie said in the video, BHOs, how do I want to explain this? Your substance use disorder and higher in mental health services would get wrapped up into managed care. It's kind of a distinction. The exemption from managed care is on the medical side, the physical health side. Hope that was clear. Alice, you want to say more?
So the clients in Clark and Skamania counties will have a choice of which managed care plan manages their mental health and substance use disorder services if they're American Indian, Alaska Native. So if they exempt out of physical health managed care, they will still have a choice of either of the 2 health plans that provide, which we can now say we have apparently successful bidders for Clark and Skamania counties, and happily to say it's Molina and Community Health Plan of Washington.
Okay, question number 2. We are a voluntary county. Will this change our status? I want to make sure. Clark and Skamania, are they currently either of them voluntary counties? I think Skamania is. Skamania might be a voluntary county now. So
this would change for Skamania. I just wanted to be clear because I think there's some voluntary counties on the peninsula that this does not affect. Yes, so, okay. Thanks, Melissa. Yes, so it will change that status.
Okay, question number 3. Will new enrollees then need to select their managed care insurance at the time of enrollment?
Yes, and this is something they have been able to do now since we implemented Medicaid plan selection earlier this year. And so that will continue. I think what you will see different starting in April when they go to select their insurance on Health Plan Finder, they will be enrolled effective the first of that existing month in which they were determined eligible. This is the earlier enrollment component of what Stephanie was talking about on the video.
Okay. Clallam County only has one managed care plan, Molina. Would they still have the option of being fee-for-service?
Yes. Because the BHO change is as described kind of on the RSN side of things, and that part will change in that county, but we are not doing yet in that county fully integrated managed care.
Will it be the responsibility of the managed care organization to coordinate care for behavioral health services for clients who live in one area but access care in a different area, such as child of divorced parents active under mom but needing to access care close to dad?
Yes, the managed care plans will be required to have memoranda of understanding with the behavioral health organizations, and specifically for those kinds of issues. So when clients cross county boundaries and need to access services in the local area, we'll have MOUs in place so they can share information and authorize services, etc.
Are Medicaid clients still able to change their managed care plan monthly?
Yes.
What will happen if a client does not select a managed care plan during enrollment?
As is the case today, they will get auto-assigned.
What will happen to clients who are fee-for-service because of third-party liability?
That it depends on their actual TPL, but most likely it will continue to exclude them from being in managed care. Many of you may know we are looking at our entire TPL business practice, so I kind of hedged my bet there a little bit.
Yeah. And just like the Alaska Native and American Indian population, if they are exempted from the medical managed care plan, they still will have their behavioral health services through a managed care plan. So they'll look like they're enrolled, but just for behavioral health services.
Yes.
Will patients that are approved retroactively from the date they applied also have a managed care plan?
And depending on how they were approved retroactively, because that can be a manual process, you know, we may not even need to do as many of those, because if they're determined eligible, like what's today is the 20th, if I went in and let's say we had the earlier enrollment functionality working today, it would mean I could go into Health Plan Finder, and if I was determined eligible today, I'd be enrolled effective back to the 1st of November. That's how this is going to work in the future.
How will individuals who are exempted from managed care organization enrollment access behavioral health and SUD services?
If they are in the early adopter region, they will get their behavioral health and substance use disorder services through the managed care plans that are doing the fully integrated product. They will have a specialized benefit package. If it is elsewhere in those behavioral health organization regions, then they'll get it through the BHO. That's it. We've got a couple of questions that people ask that are really specific. And so we may need to follow up with you afterwards on some of these.
Mm-hmm. Yeah. Okay. Given that Coordinated Care of Washington is handling only the physical health and mild to moderate behavioral health for foster care, who will handle complex behavioral health and SUD issues for foster care in the fully integrated managed care counties?
Similar to the answer earlier, this will be provided by those managed care organizations, and we will be talking more about this in the next webinar. There will be a behavioral health services only benefit package that is similar to the benefits administered by the BHOs across the state elsewhere, but these will be administered by our managed care plans to these types of clients in Southwest region. Yeah, go ahead, Jeff.
If a client is exempt from managed care plan selection for medical, and are they then able to switch mental health managed care?
Anthony, I'm not sure I totally got your question, but I think what you're asking is, will they have plan choice on the mental health side? Within Southwest Washington, where we have 2 plans, they will be able to choose. If they end up with that behavioral health services only package, they will be able to choose which of the managed care plans they want to go with for those behavioral health and substance use disorder services.
Will each behavioral health organization have contact information, and will this information be listed on the DSHS website or Healthcare Authority website?
Yes, and in fact, there will be a letter. Yeah, you can go on their website now with the website that's on there, and they may have some information up there now, but I don't think they finalized it because DSHS is going through a contracting process with the BHOs. However, there will be a letter published and sent statewide to every Medicaid recipient that will have the names and addresses of all the BHOs and which counties they're in, because the BHOs will realign to these new regional service areas. So previously in RSN that might have covered you, if might have covered 2 counties, maybe now the BHO has to cover 3 counties in a region. So all of that updated information will be available. DSHS is responsible for the BHO side, so it'll be on their website. Oh.
So back to the retro question. So with
I want to get back to Susie.
Oh, okay.
Susie, we're going to get back to you on your very detailed retro enrollment question, if that's okay. I am not expert on this. I need to talk to somebody else.
Great. So we are about to wrap up, and we encourage you all to continue to send any last-minute questions that you might have. Okay, so just as a reminder, this video and presentation slides will be posted in about 7 to 10 days on the Healthcare Authority Training and Education website listed at the bottom of this slide. And our next webinar has just been scheduled for December 4th at 1 p.m. and we'll be sending out the webinar invitation later this afternoon. And we'd like to thank you again for joining us